raising concerns about what impact that of mixing doors might have on that. Let's talk about this with our GP, Dr. Nighat Arif. Morning to you. Good to speak to you. It does feel like a sort of it's a day of excitement, but also tempered with a caution, isn't it today?
It's a day of sense of relief because we know that we've done so much work building up to this. This is different to the other lifting or easing of the lockdowns that we've had before. So we've had the third lockdown. This feels like the longest one, and the impact has been felt greater, mostly on mental health, loneliness, and people are just, there is a bit of COVID fatigue. We have to admit that people are exhausted by all of this, and we do need to come out of lockdown. And so there is this, hurrah, we've got there. And that's because the vaccination program has been absolutely phenomenal. Primary care trusts, all the doctors, nurses, healthcare visitors, the private pharmacists, everybody on the ground has done their bit, and the public have come out. We've done 50 million doses, 19 millions of double doses, so first and second dose as well. And we've always been making sure that testing is up and running. So we've got the lateral flow test as well. So all adults are eligible to get a free lateral flow test twice a week. We as doctors have been doing them since January. And then on the 10th of May, we had 0 COVID deaths in England, Scotland and Northern Ireland. We did sadly have a few in Wales, but that's death from people who've tested positive 28 days prior to that. So we know that vaccines work. We know that the pressure on hospitals and pressure in intensive care is far less. But we've always said, look, be cautious. Today you can sort of hug your nearest and dearest, which is great, but be cautious. Make sure that if you are in the vulnerable category, maybe not do that so much. Make sure that if you are meeting people indoors, that you keep windows open, allow some ventilation to happen. Please don't ease up on the restrictions that we have around masks, hand washing and physical distancing where possible, because that's how we're going to get a handle on the Indian variant. That is, we know that the only reason variants do become more out in the population, the numbers rise, is because we're not getting a handle on the virus. So the way to get a handle on the virus, we are so great at knowing how to do that now. And that always comes down to restrictive measures, because they are the things that work. Vaccines are never 100%. And that might shock a lot of people saying, well, then why are we doing a vaccination program? Well, we know that it gives you about 80 to 90% protection from severe disease and even death. But actually, there's that gap of 10% where we know there are individuals in the community who might not be fully protected. And therefore, they're the ones that might end up having the virus, have no symptoms, and asymptomatically pass it on, which is what we're having with the Indian variant, which has come across. So we've got 1,300 odd cases of the Indian variant that is spreading in our community. And this is why the screening the testing, the PCR tests, they've really brilliantly set down and started giving out PCR tests in areas like Bolton. Yes. And we as doctors are aware of it, and we're trying to make sure that we keep a handle on the situation.
Yeah, so just a couple of things. So people in Bolton who are eligible for the vaccine have been urged to take up their dose. Have you actually seen, just briefly, people with the Indian variant where you are as well?
So in Aylesbury, we've had, I think this is on the weekend, we were looking at the numbers, maybe 20 cases. That might slightly have changed, so I apologise if I'm wrong, but we have in Aylesbury in Buckinghamshire, we have got the Indian variant, but we are testing them. And remember, isolation, if you know that you are tested positive, it has to come down to self-isolation for 10 days and making sure that you're not passing on that virus. It passed through droplets, so hand washing, face covering are the ways that are going to make sure we get a handle on the situation, because we want to come out of lockdown safely.
I also want to ask you as well, on Friday, Boris Johnson announcing that people aged over 50 and clinically vulnerable will have their second doses of COVID accelerated, so brought forward from 12 weeks to 8 weeks. So what will you do about that? Will you do people who are over 50 and in those groups wait, or how will it work where you are, for example?
So where we are at the minute, we are there's a number of ways that people can actually contact us and get the vaccine. So there's also the 119 system. So if you phone, that is a vaccination hub, and so therefore they will know that if you fall into that category, they can expedite your appointment. You can actually then phone your GPs as well. Not that I'm saying everybody needs to phone their GP, because then we'll be bombarded, but that is one option. And then online as well. So you can go onto the NHS website and look at where the COVID vaccination program is happening and put your details in. It is an automatic system. GPs have no control on who gets called. So please don't bombard your GPs, because we have no control of who gets called, how quickly they get called. It's done centrally from NHS, and that's why they've got the telephone and the online system to be able to expedite yourself or get yourself into that system so you know where you are.
OK, very good. And thank you very much. Great to speak to you as ever. And good luck with the hug, because I know you'll be cautious. Take care.
I will be.
Take care.